we're tackling osmotic diuretics, specifically mannitol.
Yes, it's a really key topic, especially for medical students learning about fluid balance.
Absolutely. And we know many of you might follow channels like KMR Advise on YouTube. We're aiming for that kind of clear, step-by-step understanding today.
Exactly. Think of this as a lecture discussion, breaking down how mannitol works. We're using an explanation of the osmotic diuretic mechanism and effects as our guide.
And we'll take it, at a good pace, especially for our Indian medical students listening in.
Right. So let's dive in.
Okay, first step. How does mannitol get into the body?
It's given intravenously, so IV administration, straight into a vein.
Got it. Direct entry into the bloodstream. Then what happens?
Once it's circulating, it reaches the kidneys, specifically the glomerulus. This is like the kidney's filter.
Yeah, the filtering unit.
And mannitol gets filtered through, moving from the blood into the kidney tubules. But here's the really critical part.
Yeah.
It's not reabsorbed. Unlike many other substances, it doesn't get taken back into the bloodstream from the tubules.
Not reabsorbed. That's the key takeaway there.
Yeah.
So it passes through the filter but can't get back. It's stuck in the kidney tubes.
Precisely. It stays within the tubular fluid. And because it stays there, it increases the concentration of solutes in that fluid. We call that increasing the osmolarity.
Osmolarity.
Yeah.
Like how much dissolved stuff is in the liquid.
Exactly. Think of it as making the fluid inside the tubule more concentrated. This happens particularly in the proximal convoluted tubule, the PCT, and the loop of Henle.
So you have this more concentrated fluid inside the kidney tubes because the mannitol is trapped there. What does that do?
Well, water likes to move from areas of lower concentration to areas of higher concentration. That's osmosis.
Right. Basic principle.
So because the tubular fluid is now more concentrated, water gets drawn from the surrounding kidney tissue into the tubules. It's pulled in and kept there.
Okay. So the mannitol basically holds onto water inside the kidney tubes.
That's a great way to think about it. Water is retained within the lumen, the space inside the tubule.
And the consequence of holding all this extra water in the tubes must be more urine.
Exactly. A significant increase in water excretion. That's the marked diuresis we talk about. Lots more urine is produced.
And it's not just water, is it? You mentioned other things get flushed out too.
That's right. Along with the water, there's also some increased excretion of sodium niu and some other solutes as well.
Okay, so big increase in urine flushing out water on some salts. What are the clinical effects we see from this? Why do we use mannitol?
The major clinical benefits are reducing pressure. Specifically, it lowers intracranial pressure, that's pressure inside the skull.
Crucial in head injuries or brain swelling.
Yes. And it also reduces intraocular pressure, the pressure inside the eye. So useful in certain types of glaucoma emergencies, for instance.
Those are really important effects. But like most medicines, there must be risks.
Absolutely. Because you're manipulating fluid balance quite powerfully, there are definite risks. The main ones are potentially causing fluid overload if not monitored correctly.
Fluid overload.
Yeah, and that can lead to serious issues like pulmonary edema fluid building up in the lungs.
Okay, that sounds serious. So monitoring must be absolutely key.
Essential. Anyone receiving mannitol needs really careful monitoring.
What sort of things are we monitoring?
We need to watch their volume status very closely. Are they getting dehydrated or overloaded? Also, their electrolytes like sodium levels and, of course, their kidney function itself.
Makes sense. You need to make sure the kidneys are handling it and the body's balance isn't dangerously disrupted.
Precisely. And for our listeners, especially the students following KMR Advise, these monitoring points are crucial for safe practice. If you're finding this breakdown helpful, do consider, sharing or subscribing to KMR Advise. Hitting the bell icon helps too.
Definitely.